I'm Dr. Myla Bennett from Bella Plastic Surgery and Medical Spa, and these are the Bellas.
Hi.
We have Jessica, Kayla, Chaselyn, she wasn't with us last week, but she's back, and Mo. So, thanks everybody for joining in with us for the second week. We had a really awesome time last week. It's going to get better every week. We're learning with each show, so I loved all the feedback we got from last week. And anything that you want to see, go ahead and remember to let us know about it. You can drop it in the comments. I wanted to kind of get started talking about the very emotional farewell speech from our president last night. Did you guys catch it?
Yeah. Sad.
Sad?
Yeah. I was sad.
I mean, yeah, I guess it was sad because he's leaving.
I just didn't want him to leave.
Yeah. But it was also, I don't know, I felt sadness, but I also was proud of him. I'm proud of his family. Like we watched his daughters grow up, the last 8 years, and it was also, I thought it was kind of sweet that when I first, I'm like, it was Sasha that I was missing, and she had a test the next day, so like, it just, I can relate to that because I missed a lot of important stuff studying, trying to go through college and medical school and stuff, so I just love that family.
Do you think that she'll regret that, like not being there?
I mean,
I just feel like that was such a monumental thing.
I know, but that's life. I missed a lot of stuff, and I can't say I necessarily regret things. You do wish. That's part of growing up and being an adult, and you got to make important choices. And not luckily with social media and all that kind of stuff, she got to be there in spirit and see everything live like we did. Because I watched the stuff that I watched, I saw on Facebook live.
It was emotional.
Yeah. So I mean, I guess of course you want to be at everything, but when you're going through life and school and you miss things, I mean, it's just.
That's the president.
I guess just because look, no special treatment. They're like, you can't miss the test. I don't care if your daddy's the president.
Right.
Yeah. So, what do you think?
I mean, it was really sad to me, but I loved how he talked about Joe Biden and his wife.
Yes,
and,
I love that.
The shout out to his daughters was so cute. But people were upset apparently because he never acknowledged their grandmother for taking care of the girls, which I think was.
I think people just want to find stuff. Yeah. They just want something to be mad about.
Yeah.
But I'm proud of our president. I'm so glad that we got the 8 years with him. And we're all just gonna pray about how the next 8 years go.
Let's hope for.
Yes, I'm positive. I'm gonna think positive thoughts, onward and upward. Moving on to the next. So, who saw Golden Globes?
I did.
I definitely did.
I watched it. I didn't watch it all because it's super long, but I watched it.
I didn't watch the Golden Globes, but I watched red carpet stuff.
Well, that's still.
Yeah, I never watched the award show.
That's like the fun part.
Yeah, I didn't watch the Golden Globes, but I did watch some of the stuff on the carpet. Who was your favorite?
Emma Stone.
Me too.
She looked good.
She had one.
She had a sequin dress. I know it had stars on it. She's just pretty. Like her skin is flawless. She looks like a porcelain doll. I love her.
I missed her somehow.
Mandy Moore was gorgeous.
Oh yeah, she looked pretty. Her
Yeah,
skin
she looked really simple and classy, and her skin was
She always was.
amazing.
Yes, Karuchi's skin was awesome. I didn't really love her dress though.
Her hair.
Yeah, but her skin was pretty and her makeup.
You liked her hair too?
No, did not like it.
It was a little too much.
Well, I liked her skin. She posted on Instagram earlier that day, and she had like a gold mask on and a mask on her lips.
Oh yeah.
So she was getting ready, and you can tell because her skin was glowing.
Yeah, flawless.
Yes.
Flawless.
We love beautiful skin.
Yes.
So, speaking of skin, how'd you like that machine we tried out today?
Obsessed with the machine.
So, for anybody who didn't catch us earlier, we had we were trying out this new technology, which is I think it's pretty amazing. It was a salt facial, and we combined that with a vampire facial. So that whole treatment, it really embodied the essence of the things we like to do to make our skin glow. It was a lot of different things going on in that procedure.
A lot of different steps.
Yeah. What do you think is going to be? What do you think that it'll help us with? What skin problem do you think it'll help us with the most?
Ooh, so many things. The salt exfoliation part, I feel like is going to be most beneficial for acne. Just because sea salt, not your regular table salt, But sea salt is antimicrobial, antibacterial, and so it's great for acne.
Because we pulled that thing out today on a few people for acne.
Yes.
We use that machine a lot today, so I'm really trying to get a feel for what we can do with it. And so we had a couple people come in today who had active acne, like pimples out, and we did that to you, Kayla. Look, look at this face. Look, where did the pimple go? Okay, I still see it a little bit.
It's there, but it's a lot better.
It's a lot better.
Yeah.
So it basically pulled a lot of the redness out.
It does.
It flattened it some.
Yeah, it calms and soothes the irritation, and then it's also good for like if you have dry skin, because most people think sea salt is drying to the skin, but it's actually making your skin retain hydration and moisture.
So it was pretty good, yeah. So we used it. So what we did today is we were going to do a vampire facial on this person. The patient, it's actually my lash artist. Shout out to Ava. She did it too. Yeah. So we were planning a vampire facial for her, and so then when we had the salt facial machine, we decided to go ahead and do a really good exfoliation on her face before the vampire facial. So that makes it so that with the vampire facial, we draw the person's blood, and we process the blood and get it's called platelet-rich plasma that we pull out of the blood that we collect. And the platelet-rich plasma has growth factors and some stem cells, and the platelets, when they are activated, lets out all of your body's natural healing factors. And so normally we'll needle that into the skin, your own stuff into the skin, and it causes collagen production and stuff like that. Well, when we get that top layer off, it's called the stratum corneum, that we were able to exfoliate off of her face. It made it so that we were able to get a deeper treatment. Yeah. So the sea salt in that machine is kind of like a little bit like microdermabrasion, but better.
But way better.
Yeah, way better. It was more aggressive. And so then we got a really good treatment with the vampire facial. And then the salt facial machine has an ultrasound. It's a 3 megahertz ultrasound. It's like cavitated ultrasound, meaning it can push the particles in even deeper. So it drove her PRP even deeper into the skin than it would have been without it. And then on top of that, the machine had like these powerful LED lights. It was like the treatment that never ended. It was so much. So her face was so red, like it was she was red like a lobster when we finished.
Like a really, really bad sunburn.
Yeah, it was so red, and the LED lights, it was, what do you say? It was like 1,775 lights.
Crazy.
That thing was so bright. When you put the mask on, like you use the goggles that are the opaque goggles. They're like metal, and you can't see through them. And when that light comes on, you still see it. When I got that done to my face, I had the goggles on, my eyes were closed, and it was like this big, like I could see
Jesus, I'm coming.
It was so bright, but it was wonderful because it calmed all that redness down. So instead of her looking super red, she just had a nice little pink glow when she left. So, and she texted me this evening and was like, "Oh my gosh, my face feels so good. It looks better already."
Yeah.
The great thing about vampire facials is once you get the treatment, like you get younger and younger every day for like 2 or 3 months. Yeah. You literally get younger and younger every day. So she's just getting started. She thought she looked younger tonight.
That is absolutely going to be my favorite facial for 2017.
What?
By far. The salt combined with the vampire facial.
Right, we gave that a name today.
Red Lux.
The Red Lux facial.
Red Lux facial. Yeah.
Yeah, so
she made it look beautiful too.
She did make that look beautiful.
The blood on her face so bomb.
She was giving face with blood.
It was amazing.
And then
don't you feel like she got that kind of reaction with the microneedling because we did the salt first, because we took off that layer, like because
it went deeper.
Don't get as red and bleed.
Right. Everything went deeper. Yeah. So then if you have a layer, he said that the machine can take up to 50 microns off the surface, which sounds like a little bit, but it's actually a lot.
It's a lot, yeah.
And so if you're starting from lower, then the needles can go lower. So if normally you're starting here and then you take this much off, then the needles the needles can go deeper and be more
because I had a
effective.
really low setting. On
Yeah, I
that.
know, because she was bleeding at 0.25. So with microneedling, we're talking shop now. Okay, so let me bring everybody else and be like, what are you talking about? So Jess is my partner in crime when it comes to skin. So with microneedling, we are treating, your skin is different thicknesses in different places on your body and in different places on your face. So to get a really effective treatment, you want to make sure you're at the proper depth for the area that you're treating. So normally on the forehead, we'll drive the needles into the skin 0.5 millimeters, and she did half that, and we got a lot of bleeding. Now I know it sounds crazy, but we like bleeding. Bleeding means if a person doesn't turn red or I don't see blood, then I'm like,
We didn't do enough.
Right. Okay, so it's a medical spa. The medical part is the most important word in it. Okay, spa, she makes you feel good before and after we torture you. But in the middle, we make sure that you get an effective treatment. So she got great bleeding, nice redness, and then we drove all those good healing properties in from her platelet-rich plasma with that ultrasound, and that was like a mega facial. I think that's gonna be like one of our
That's my favorite.
most popular facials. Cause I can't wait to make. I got a salt facial yesterday by itself, and so tomorrow I'm gonna make her do that on me with my vampire again. Okay. I need all of these things. I want the red lugs. Okay, we can swap red lugs tomorrow.
Okay.
All right. So we can use the salt facial, the vampire facial. These are great things to use for not just acne. We have a lot of acne clients, but the vampire facial is most popular for
anti-aging.
Yeah. So that's a treatment that people tend to get when they're in their 40s and 50s and really trying to aggressively reverse things. I got my first one when I was 38. I just turned 39, right?
And I just
I got my first vampire facial when I was 38. I used to get plain microneedling, and then I started looking old this summer, so I had to step it up. So, but yeah, usually it's people in their 40s.
I think it's better to start earlier.
But the earlier you start, the better. That's the whole preserve your pretty thing. Preserve your pretty. So Ava is nowhere near 40 anybody. She's like, we're not supposed to tell her age, are we?
No.
I tell my age, but I think she's in her late 20s, I think.
Okay.
So she started early, so
That's good.
Yeah.
Because I was asking Jess, I was like, when should you start doing those type of treatments? And she's like, you know what, you're 30. She's like, but you start earlier.
Right, the earlier you start, the better. The earlier you start, the less you need more aggressive
More
things like
stuff
surgery.
later.
Yeah, so
And
especially on
Botox.
right. Especially on people with more fair skin, because they age more aggressively. Like the lines come out sooner, so you want to be more aggressive with your treatments early if you want to keep that stuff from happening. So that's one of my favorites for anti-aging. The Botox thing. So everybody loves Botox. Of course, I do Botox. I don't do as much Botox as the average plastic surgeon or dermatologist does, because I feel like
You actually talk people out of Botox.
I do. People will come in here for the first time for Botox, and they'll leave with skincare regimen. And then I'm like, just let me try this for a while, and then we'll do Botox. Just give me a couple months like this, and then let's do the Botox. Because the reason why I do that is because I think it's overused. Botox paralyzes the muscles in your face to keep you from producing wrinkles where those muscles have been working. So over time, just like with a piece of paper, if you have a piece of paper and you fold it in half and stick it in your Bible or stick it in this book and you leave it there for a while, that is, as long as it's folded and it keeps being folded and being pressed there, and you open it back up and try to flatten it out, you'll still see the crease. So people start getting Botox when their skin is the equivalent of that folded piece of paper and the crease stays there. When the crease is there, when you're not making the expression, that is when people start to get Botox. So they're like, oh my God, these lines, I need to get rid of them. And so instead of taking care of the skin, making the skin more supple so that it can fold and go back flat without leaving a crease behind, they just try to fix it with the Botox. And so you don't look younger, you just look like a frozen old person. That's my philosophy. Because my 3-year-old and my 6-year-old, when they raise their brows go up. When they're angry, you can tell. When they're surprised, little lines in their forehead come, they move. And so I try not to like take the movement away. And then when I do Botox, and some people they still kind of need it, even with the skincare, then I use less of it. And so I just soften it. I want things to move. I'm all about making things look natural.
Yeah, I'm not.
Oh, go ahead.
I was gonna say I'm not against Botox or filler, but I like the natural.
The natural look,
Yeah,
make it do it in moderation.
Look so frozen.
Right. We have a question.
Yes, we have a question. What are good pre-treatments to use in conjunction with the vampire facial?
A good pre-treatment for any facial of that magnitude is a home skincare regimen.
Mm-hmm.
So everybody in my practice, if somebody comes in and they want a vampire facial, which here, that's an $850 facial. So if you're getting $850 facials, you should be doing something at home. The good thing about doing something at home is one, it makes the treatment more effective. So the way I help people understand it is if you go to the dentist to get your teeth whitened, and then you're like, oh, my teeth are white, I don't need to brush my teeth anymore. Like, that doesn't make any sense. You have to go home and you still have to brush your teeth. So the vampire facial and stuff like that is kind of like the equivalent of teeth whitening at the dentist. It's like, it's icing on the cake, it makes things better, but you have to be maintaining it at home. So we have our clients, usually if you're in the anti-aging world, you're going to be on a regimen that's going to exfoliate, you're going to have a good exfoliant. You're going to have a good cleanser that is going to treat whatever ailments your skin may have. So if you're dry, you want a cleanser that's going to hydrate. If you're oily, you're going to want a cleanser that's going to reduce the oil and cut down on the inflammation from the oil. Then we want to have some sort of pigment corrector or something to help keep your complexion even. And then you want something for anti-aging, which basically is a retinol. That's like the super basics. We still try to have
Sunscreen.
And you gotta have sunscreen. Lord, I can't believe I didn't say sunscreen. Sunscreen is one, okay? And then you gotta have some, what I think of like vitamins for your skin. So like antioxidants and peptides. So it's, the regimens are usually pretty dynamic and we're hitting on different points of what makes a person's skin not be pretty. And then when you get the services, if your skin is in good health, when you get the services, it magnifies the result.
I think that's really the key
Yeah.
too, is like you want to have your skin as strong as possible before you come in and get these aggressive services. Because if your skin is already weak and it's not pre-treated, then you come in and get a service like microneedling or the vampire facial. Number one, your results aren't going to be as good. Your downtime is going to be a lot longer. You're going to be more irritated, more red, bleed more, all of those things.
So I found that when before I became like a stickler for having people be on products, when I first started microneedling people, it took 3 to 5 treatments before you saw any improvement with microneedling if you're not on products. But if you're on a good regimen, a medical grade skincare regimen, and you get microneedled, you notice a difference with the first treatment.
Right.
So you're gonna go pay for 5 microneedling sessions, $350 a piece, to get to a result. But if you're on products, you'll see some improvement with one.
Right away.
Yeah. Yeah. What's your favorite service that you get, Mom?
Microneedling. The last one I got recently, like my face was like, it was harsh on my face, but I feel like because I haven't been getting treatments as often as I should, it made a big difference. And like the day after, my skin was glowing. I felt like the acne started everything.
Feels tired.
Yeah, and then also going home using my products. So Jess got on me. She was like, you better do your morning and night regimen. I'm like, okay, I'm gonna try. Make sure when you wear makeup, you get dolled up. Make sure to cleanse it off and use your products. It's like
They're the worst patients.
What
Y'all
about
have this makeup on tomorrow morning.
we don't play that. You do not sleep in makeup. That is a no-no. Chaselyn, what's your favorite?
Microneedling.
That's your favorite too?
Yes.
You're a wimp. I'm surprised that's your favorite.
That's the only thing that I'm gonna get as of right now. I mean,
Well, you don't like hydrofacials?
yeah.
You had hydrofacial?
No, she hasn't had
What?
I've had hydrofacial. I only do microneedling treatments.
How did that happen?
I think I'm only here one day with her.
You know.
Well, we need to do something about that. Sorry. Oh, hydrofacial. Oh, sorry. Hydrofacial is my other favorite service. Yeah. So you have to get a hydrofacial. So hydrofacials are awesome. They're like microdermabrasion, but better.
Better.
And the reason why they're better, so with microdermabrasion, you're going to get an exfoliation, and it's going to pull dirt and makeup and bad stuff out of your pores. And that's pretty much it. It's kind of a mechanical treatment. Hydrofacials have the mechanical aspect of microdermabrasion, but then you have the added benefit of cleansing out the pores, so it washes out your pores and cleans your skin, and then it puts hydration back into the skin cells.
Right.
Yeah, so we do hydrofacials a lot. In fact, even our specialty facials here at Darabella turns on
my favorite.
Yeah, Jess goes and turns on that hydrofacial machine anyway. She still does. Yeah, she mixes and matches all kinds of stuff. Yeah.
I love a hydrofacial.
Your facials are my favorite. Like, she gives the best facial.
Yeah.
Every facial she gives, it's just, you want to fall asleep on the bed. Yeah, it's amazing. And the massage that you combine with it, it's awesome.
It's not when she gets out.
No, I can't stand when she does extractions, but I always need it, and she loves to extract. It's like her favorite thing. She loves to see stuff come out of people's skin. Like, it's disgusting. But
It's my passion.
I think every esthetician loves doing extractions. I hate extractions. I don't get it that much.
You don't.
Why you get attitude? I don't. When I did before I started doing all this stuff, when I would get facials and I would need extractions, I don't really like that. I don't do those now. But when I did used to get them, it would always bruise me. Like I would look like why y'all want that?
Well, we get in there.
You get in there. Okay.
I like a simultaneous eye roll.
Look, I had a 4-year head start. That's
true.
So y'all, y'all get there.
yeah, but everyone's skin has come a long way.
It's come a long way.
Yes.
Yes. And you don't have any pores in your nose.
Thanks to you guys.
So you still get
Thanks
extractions?
to me.
Yes, my nose, for whatever reason.
It's only her nose. That's
Yeah,
it.
I don't know why.
Hmm.
I don't know why. Yeah.
I'm just lucky. Yeah, but when I used to get them, it would bruise my skin. Like I would get bruises.
Well, no, that was the esthetician.
She was like, that's not
anybody.
I was like, oh, I don't like these bruises like Rudolph on my nose. So I was supposed to have that.
No,
Oh.
she didn't pre-treat first.
So how do you keep that from happening then? Because I really honestly didn't know that. I thought that was normal.
No, absolutely. A couple things. So there's a couple things you want to do to kind of open up the pore. That way, everything comes out easier. So steaming is one thing. I use the Detox Pore Gel by PCA Skin. We have that in Back Bar, so I massage that in. Like I massaged her little nose for like 5 minutes. She was like, "This is so awkward," but I just literally sat there and rubbed her nose for a while. So that, along with the steam, just makes everything come out really easy. So I don't have to really press very hard.
I can't remember if all that stuff
Oh,
happened.
it was a little hard. Okay.
She was like, that's what you said.
No, it hurts. To me. I might be sensitive, but
she's a baby.
it hurts. Like,
Does it hurt?
The tip
No.
baby, but I need it, so I'm gonna deal
Right,
with
it don't
it.
even matter.
Pains me.
oh god.
Oh, it doesn't matter. I literally. That's so funny. People are like, does it hurt? What's the pain?
Right, that is
level?
neither here nor there.
This is a medical spot,
Exactly.
so it may hurt, but it will work. So hurt doesn't matter. It doesn't feel as bad as microneedling.
No.
I bet
No.
So I know.
Yeah.
Yeah. So we wanted to do we wanted to do a product of the day. We didn't bring it up here. Oh man. Okay. So Jess, I'm gonna put you on the spot then.
Oh.
Okay. You know what? This is what we'll do.
Okay.
Everybody will say what their favorite product is.
Okay.
Oh, you know yours? Okay, you go first, Jason.
Can I say?
Oh, hold on. Before you do that, we have another question.
They want to know if Jess can explain extractions.
We just did
When
that.
you are all saying.
Okay.
Okay, yeah, go ahead.
Yeah, no, I can explain it. So extractions is that's like the crucial part to me of any facial that you get. If you go anywhere for a facial and they don't do extractions, then I would ask for my money back. So I mean, unless your skin is just poreless and flawless, and you just absolutely don't need them, then that's one thing. But I feel like the esthetician should at least try to see what they can get out of the skin. So basically, that's just some estheticians use an extraction tool. I don't like those. I don't use those in my treatment room because I do think you can leave bruising.
She did
or
use an
scarring.
extraction tool when she did my nose.
Okay.
I do remember that. It
Okay.
was like this little loop.
Yeah, that.
Yeah.
Yeah, and that could have been why you bruised.
Okay.
I just use my fingers. Obviously, I have on gloves, and I just make sure, like I said, I pre-treat the skin, and I'm basically just kind of opening up the pores, and then I take my fingers and wrap some cotton around them, and I just go and I just kind of squeeze on the skin, and basically get anything I can get out of the pores, whether that be dirt, oil, any of the, I was gonna say blackheads, anything that's clogging your pores, I basically squeeze it out. So that's all an extraction is.
Why do people's pores get clogged?
So, couple
It's a
things.
lot of things.
Yeah, I was
That's
gonna say
a good one.
a couple things. If they're not using a good skincare regimen, obviously if they're not using like a Clarisonic brush, Clarisonic brushes are great for cleaning out the pores. A lot of people think that they're just for exfoliation purposes, but it actually,
I mean,
You wanna do
it
your little-
sort of does that. Okay.
yeah.
So with the Clarisonic brush, most people think, oh, it's just to exfoliate, and the cheap knockoffs, that's all they do is exfoliate.
Mhm.
The Clarisonic brush, if you think of my fingertips as the surface of your skin and the web spaces as your pores, you can't physically get dirt, makeup, bacteria out of here from the surface with a washcloth.
Right, you're just
So
rubbing the top.
you're just rubbing the top, and so this stuff is still down in there. So the Clarisonic brush, it oscillates back and forth 300 times a second, and so when it's doing that, it's just like a washer. It agitates all the dirt, makeup, bacteria. It agitates it out of your pores. So when you put your cleanser on the Clarisonic brush or lather your face up and go over with the Clarisonic brush, those suds and that agitation bubbles everything out, and so that empties your pores out. Now, two things happen from that. If your pores are stented open with dirt, makeup, bacteria, it's impossible for them to close because your stuff's in there, so they can't relax. So when your pores are cleaned out, now they can relax closed, so now your pores will appear smaller. And also the wonderful products that you're using every morning and night on your face, instead of coming in and sitting up here on top of the dirt, they can actually go down to the base and the bottom of your skin
And
work,
actually
be
do
more
what they're meant
effective.
to do.
So that's why the Clarisonic brush is important, not for exfoliation. It sort of does that, but that's just like a side effect. It's kind of like, oh, you get some exfoliation too. The point of that brush is to clean your skin.
Mhm. So a Clarisonic brush is a must, and then using a good exfoliant, because you have dead skin cells that build up on the surface of your skin, every single day. So if you're not using a good exfoliant and getting that off,
It clogs
it's going to
pores.
clog the pores. Makeup obviously clogs pores. If you're using the wrong kind of products that are not non-comedogenic, then that's going to clog pores. Who says they put shea butter on their face? And I freaked out.
Yeah.
Yeah. Things like that. So you just have to be really mindful of what you're using and make sure you use the Clarisonic
Okay.
brush.
We're gonna take one more question and then we'll wrap up. What was the other question?
Okay, so this isn't a question about skin, but the question is, what are some non-invasive stomach reduction techniques?
Okay, we will talk about that it's not gonna be next week, because next week we're talking about all things lips. I'll answer that, I'll say some things in the comments for that one. This is a skin talk. All right, so we didn't get to our favorite products, we'll do that another time. We're gonna go ahead and sign off now. Thank you so much for joining us again for episode 2 of Pretty Talk with Dr. Myla with Jessica, Kayla, Chaselyn, and Mo. And we will be back next week talking about all things lips. Bye.
Bye. See you next time.